And I don't really know how we got started talking about fetal demise after a Baywatch video, but I do want to say that this is a very valid conversation, and that there is no correlation that should be made from the ridiculousness of this video compared to the seriousness of our conversation. Yeah.
Ooh, Hasselhoff.
Oh, dude, this is him in like prime form.
Oh, wait.
She's pregnant enough to be full term?
No.
Here we go. Here we go. The Baywatch run.
Oh, yeah. Take off your shirt. That's going to help you.
Look at those traps.
Well, why do you almost drown yourself when you're having labor? That doesn't make any sense. Why do people think labor happens this fast? And why are seagulls involved?
This is why everyone rushes to the hospital, because of like this.
They don't want
one
David
contraction.
Hasselhoff to deliver their baby. That's why.
David Hasselhoff can deliver my baby.
Even now when he's like 80? Are you
Definitely.
Sure?
Totally.
Oh,
those blue eyes and curly hair.
Oh, Jesus. Like, why does everybody get laid down on their back? I don't understand this. This is
so that David Hasselhoff can see better.
Oh, he gets his emergency obstetrical kit. Excellent. Run back. Oh my God.
Look at these sterile gloves he's got going.
Yeah, but it's not sterile, especially
not anymore.
This is so dumb.
Sponging?
Gauze.
Yeah, what's he gonna do with that in sterile gloves? That's not gonna work at all.
Opening her one-piece swimsuit.
She's gonna deliver with her one-piece suit on. Actually, that almost happened to me once. I had a mom and I was like, I have to take your pants off now. Your baby's head is out. And she's like, no. And I'm like,
they both look like they're enjoying it though.
Wait, oh, good. I'm glad we have cord clamps. We have cord clamps in the sand. That's fantastic. Oh, finally. There's her 3-month-old. He kept it a really long time. Oh, because it's his baby, really. That's what he's saying.
That is a huge baby.
That's a 6-month-old.
Okay, but David Hasselhoff crying because he just delivered a baby. That is like the best thing I've ever seen.
Oh, Layla. Oh, you deserve him. Oh my God.
Scroll back a little bit. Just Bekah, go back. I want to see those tears again. Oh my gosh.
There you go, Layla.
It's yours. Congratulations. You've won David Hasselhoff in this particular raffle. Congratulations.
Now, he might be a better midwife than me.
What? What did you say? Sacrilege.
Yeah, and this is where we need to cut it because Layla's talking complete nonsense.
Mm-hmm. You here, cheers, Layla. You have some more wine.
So
with David
I've
Hasselhoff.
never cried in a birth before.
What?
Never.
What?
Not for beauty or trauma.
Not for your own?
Not for my own. I'm a
I
cold
was
heart.
9 and I didn't. I was just shocked.
Well, I've cried. Okay, well, real talk for a quick second. Okay, hashtag real talk. Have you ever attended a birth with a loss?
No.
You will cry.
Yeah, I'm sure. That's probable. Yeah, no, I'm sure that'll happen someday.
It happens to every midwife. If you practice long enough, it'll happen to you.
If you practice long enough and you have enough of you take enough, numbers. It's just a numbers game.
Exactly. Yeah, then you cry.
Yeah, that makes sense. Like I almost cried the other day.
You cry at every birth.
Out of relief.
Once you've been cracked open like that, every birth causes you to cry.
Okay, tell me if this is too triggering of a question for you. But what do you do? Like, what does it look like when that happens?
Well, there's a huge difference between a planned expected loss and an unexpected loss.
Do people do home births where it's it's a stillborn, then they know
that's the more common. Yeah. No, if it's an unexpected loss, we have a real crisis. Something was missed.
Mm-hmm.
with the degree of technology and scans and fetal surveillance and NSTs and ultrasounds, there is a very, very, very low chance that with good modern midwifery care, we would miss babies who don't make it through the process. Because we should, even if we had good prenatal surveillance, we should also have excellent labor surveillance so that we know that the babies we deliver are healthy and normal and risk assessed appropriate for out of hospital birth. So we should not lose babies unexpectedly, honestly. Now it happens. There's a lot of up-leveling of skills that needs to happen with home birth midwives around the United States. There's a lot of up-leveling of EMT services that needs to happen around the United States. I know of multiple stories of babies who were appropriately transferred but lost in transit because the NRP didn't know how to do NRP. The EMTs didn't know how to do NRP. They
Intubation.
They didn't know how to intubate. They didn't know how to monitor. They kicked the midwife out of the bus and then did nothing for the 20
and did no
transport.
warming.
Exactly.
No warming.
So EMTs need more up-leveling skills. And then so does the receiving hospitals, right? So nurses, physicians, ER docs, OBs, I mean, the list goes on and on. If they don't know how to take report, trust the midwife who's saying, we have a cord prolapse, we're transporting immediately because of a cord prolapse. And they're like, we'll assess you in triage when you get here. And then they miss it, like, everybody needs to work together. One of the reasons why the US has such poor out-of-hospital births is not because the midwives are undertrained, it's because the system fails them. When we have integrative midwifery care in Sweden, in the Netherlands, in the UK, we have excellent outcomes because the receiving providers go, a midwife? Oh, they totally know what's happening. Tell me what's happening. I'm going to respond based on what you're reporting to me. In the US, we have such hostile care that the docs will literally, what I call punitive care. They'll make people sit in the waiting room for hours. They'll lets people sit on stretchers in hallways and not evaluate them as a punishment for their birth choice. Yeah. That's criminal. So planned births that have poor outcomes are actually more common than unplanned. And this is where the birthing family has made a conscientious choice to say, my baby has a condition or a syndrome or a diagnosis that's incompatible with life. There's absolutely no reason to subject myself or my baby to the high-tech hospital environment. I'd like to birth in the comfort of my own home, much like a hospice choice. And I'd like to have midwives and my doula and my friends and my grandma and everyone I love around me to witness the birth and death of this baby. Now, midwives choosing to support that is their own level of expertise and skill and comfort level and et cetera, but there are many who do. I do myself. We have a new instructor in midwifery wisdom who's a deaf midwife named Mariah, and she's writing a book about this. And it's a very valid, very appropriate choice. And when there's incompatible with life condition, like one of the trisomies or hydrocephaly or anencephaly, or there's some issue where they're not going to make it, and they've had enough prenatal surveillance to know that it's not a risk to the birther's life, then it's a totally appropriate community-based choice. And in which case, it's actually, it can be quite beautiful, but there's nothing more moving than witnessing the birth and death of someone in the same day. Yeah. And so unlikely in this day and age that you don't know about these things. Yeah. So unlikely. With good prenatal surveillance, appropriate risk assessment, birthing within a normal due window, 35 to 39, 41, 42 weeks, 37, 38. I mean, everyone has their own definition of term and every baby midwife's hands and laws and whatever but there's a 5-week window that's appropriate for a baby to be born in. So with good risk assessment, good prenatal surveillance, good labor surveillance, good dating, then it's very, very unlikely for there to be a fetal demise that's missed. Yeah. Does that answer your question?
Yeah.
It's definitely something I'm really passionate about. is helping midwives have the skills to make those calls. Because there is a small but very significant number of babies who tell us in the very last few days of their pregnancy or in their labor that they do not want to be born normally. And helping community-based midwives discover which babies those are and make the appropriate referrals or transports is a huge part of my passion.
Yeah, and like for babies who maybe already passed in utero, and choosing to have a vaginal birth, like I obviously have so much to learn. My question is like how they're an active participant, you know, like they're not, you know, kicking against the fundus and twirling, you know what I mean? Like it's a very different physiological birth flow, I'm assuming, because they're not an active participant in birth. So how, you know what I mean? Like, do you need more?
It's a much harder
birth. Do you need more? It's
a much harder birth. Yeah. I don't personally. If there was a primate who wanted me to support her in a planned fetal demise home birth, they would have to work very hard to convince me. I would do a multip any day. Because the tissues are so much more yielding, because the body is so much
baby
more
could kind of like come through without
the body just remembers, you know, the way that you have a second or a third or a fourth or a 10th baby is very different than the way you have a first baby. And so for basically anything other than a straightforward term vertex birth, primates have to convince me because it's just so much harder. And it doesn't mean they shouldn't have midwifery care. They should absolutely have midwifery care, but that midwifery care might need to happen in a hospital where we have the option to do IV Pitocin or cytosecond.
Because then it does pose risk to the maternal, to the birther, right? Because
just like any dysfunctional labor poses risks to the birth.
Yeah.
And when the baby's not an active participant, it is longer, it is stronger, it is harder, it is more likely to remain malpositioned, asynclitic, OP, dysfunctional progress. And there's an emotional component that we can't ignore, right? I mean, this mama already knows that her baby's not going to make it. How much emotional, psychological energy does she really have to push for 5 hours? Not that much. And should she really?
Yeah.
You know? And then depending on when the diagnosis of the demise was made compared to when the delivery actually happens, sometimes there's some pretty severe maceration. And this is probably a conversation most people don't want to know. So like hashtag trigger warning. But floating in warm, salty water is a fantastic way to degrade tissues. In fact, for all forensic investigators, that's your nightmare because you have a hard time with identification because it changes the tissue so significantly. So any delay in diagnosis of that fetal demise puts that birth at risk because delivering that baby who is now very bloated and macerated is very, very difficult. And I had the privilege and the horror of helping with some of these deliveries in Mexico and Jamaica in the beginning of my career. And of course, I lost my little brother at his birth when I was 6.5. And so I've been no stranger to welcoming babies who don't make it. And I think it's a long, hard, heavy conversation about where and when and who and how. And I think if a midwife doesn't have those skills, they should definitely refer out because it's so heavy. It's so much. And it affects us.
Yeah, but I still think that birthing people have the choice. Should have options and should have
they
choice.
Should.
You know,
we should have more midwives trained. More and more and more midwives trained to support this process, no matter where the location is, home, birth center, hospital, et cetera, et cetera.
And stillbirth, miscarriage, abortion, like choices and options and availability.
Yes.
You know, I think of like as a birthing person, my concern with birthing a sleeping baby, right, would be like the absolute avoidance of a cesarean. Like so incredibly more than with a baby that's live, because I'm going to try again.
Mm-hmm.
Right. And I do not want to have to worry about VBACs.
Impacts everything. Yeah.
And so like now I have to VBAC. Now I have to find a VBAC supportive provider. Now I have to worry about uterine rupture. Now I have to worry about, right. So like that is a huge proponent for a birthing person, is like considering, yes, you want to check out and maybe not feel this birth, and maybe, you know, Pitocin with an epidural and just like letting this vaginal birth happen would be a great idea. But on the other hand, avoiding the cascade or the interventions or the challenges that come with Pitocin and epidural that lead to the cesarean that you now are sitting with a VBAC desire is like totally on the mind. So that's where like a home birth with a educated midwife might be a better option in order to
or a hospital birth with a very educated and supportive doula who could labor at home with you for quite a while. These are all great things.
Yeah.
But the education and the choices is at the center of all this process. And I don't really know how we got started talking about fetal demise after a Baywatch video, but I do want to say that this is a very valid conversation, and that there is no correlation that should be made from the ridiculousness of this video compared to the seriousness of our conversation.
Hasselhoff was crying, and I said I've never cried in a birth, and you asked if I'd ever been.
You're right. That's what did it. Well, okay. This is #rabbit hole. That's what this video is. But I would just like to say that this topic is so serious and so real for so many people. It is a statistical reality that 50% of all conceptions end in miscarriage or loss of some kind. And it is a statistical reality that of conceptions, there are 110% of conceptions are boys, but only 92% of births of those pregnancies end in births. I don't think I have my numbers right, but we could check this out. But essentially, male pregnancies miscarry more often and have fetal demise more often, whereas females have less and less, but there's less of those conceptions. Either way, it's a significant issue that many people deal with. Many families wanting to be birthing people, new potential parents, young parents, repeat parents, young teenagers, 45-year-old women, people of all walks of life deal with fetal loss. And it is a really significant topic. And I think, kind of to wrap up this very, very strange conversation that we've had, it's that you do have options. Look for your options and know that what you're being told in the mainstream is not all the story, and that you can find someone who works just for you, a midwife or a doula, that helps you sort through all the rhetoric and all the details and find what is the best path for you. And that might be a scheduled cesarean, or that might be a home birth. And both of those are options, and everything in between. And I think it's really important that we keep having these conversations. One of my best recommended resources for term loss specifically is a book called Ghost Belly by Elizabeth Heinemann. And I've gotten to interview her several times over my career. And she is a English professor, so she's an exceptional writer. And she had a baby late in life who turned out to be a late-term fetal loss. And her research of what was possible, her descriptions of what happened to her, and her discussion of the politics around fetal loss is really profound. I highly recommend that book. It's called Ghost Belly. Yeah, big resource. Thanks for bringing this up, you guys, and thanks for reviewing these videos with me. I know that they are just jumping off points, and they're meant to bring up these exact kind of conversations. So I appreciate you both being willing to be in these kind of tough and funny and ridiculous and intense conversations with me.
Yeah, we've had quite a night. What was that, like a precipitous birth in a lagoon, David Hasselhoff and stillbirth conversations, and the midwives that you're literally sitting in their offices. Yeah. Like, let's go.
Let's go. Like all of these options right here.
Totally.
Crazy
Okay.
that we chose one to review of who I'm like randomly occupying their office space right now. That's just blowing my mind. We're gonna link to them in the video in case you want to go see Motherhood. How fun. How amazing.
Yay.
Well, thank you guys. Have a great night. Thank you.
Thanks so much for joining with us, everyone, and we'll look forward to more Midwifery Wisdom Reacts.